Hello everybody and welcome to my series of vlogs which are focused mainly on the hands and feet and toenails. So today we're going to talk about fungal nail infections, and the reason for that is I see this in my GP surgery probably on a weekly basis with people wondering what to do about their fungal toenails, and usually it's on their feet, it can be on the hands as well. So what is it? Well, we have fungus living all over our body, which sounds a bit gross, but actually it lives in harmony with bacteria and there's a balance and it's fine and it's keeping us safe. However, sometimes it can take over and overgrow and become a problem in any body part. So for example, women get vaginal thrush, and fungal nail infections are exactly the same thing. The fungus that's naturally there has taken over and has caused an infection. So on the toes and hands, this is called tinea unguium when it affects these nails, these particular parts. Tinea is always the word for fungus, and then the body part is the name afterwards. So fungus loves warm, moist areas. So feet are perfect because they're in socks and then they're in shoes or tights and shoes, and they are hotter than other body areas, and so they're more likely to become infected. It's often the same fungus that causes athlete's foot, ringworm anywhere on the body, or jock itch, which is men get an itch in their pants around their private parts. So untreated, it does cause symptoms in terms of discoloration and lifting and crumbling of the nail, and it can cause a nail to break down. So who gets fungal nail infections? Because some people seem to never have them. I've never had one, but other people seem prone. So some people are more at risk. Certainly if you've got diabetes, you're at risk. If you've got a poorer circulation in your lower legs, feet, hands. If you wear artificial nails or you're over 65. If you've got a skin injury around the nail that becomes infected, as I said, sweaty feet. If you use public swimming pools or gyms quite often. If you're taking medication or you're having treatment that leaves your immune system suppressed, so you're immunocompromised. If you wear closed-toe shoes like trainers or boots, which of course we all do in winter when we live in this country, it might be hot now, but winter will come, that's guaranteed. Men get it more than women, for sure, and adults get it more than children. And there seems to be a family link. So if someone in your family has a fungal nail infection, you're more likely. Now that could be from an infection point of view, that you're passing it on, or it could just be a family that are prone to this particular illness happening. So what are the signs and symptoms? Well, as I've said, normally it's asymptomatic, so you don't really have any symptoms other than usually the nail edges start to discolour and it gradually gets bigger and bigger. So you'll see a yellow discoloration at the edges of the nail, which is slowly spreading inwards. This spreads to the middle and it joins up, so the whole nail becomes yellow. And then what you'll find is that the nail starts to lift away from the nail bed at the edges. And the nail will become much thickened. I mean, I think toenails get really, really thick and horrible as you get older anyway. And that's why I always keep nail varnish on mine. But with a fungal nail infection, they'll become even more thick and dish-shaped. That's not a good word, is it? Mal-shaped and discoloured. But you can also see things like white or yellow streaks on the nail, scaling, little flakes under the nail, flaking white areas on the nail surface, pitting of the nail, so dips or digs in the nail, yellow spots. The nail can start to crumble at the edges where it's discoloured, and eventually the whole nail can come off. So cosmetically, it really isn't very nice, and I do get patients say to me from time to time that it can be painful, although that's not a predominant feature of a fungal nail infection. So what should you do? Well, unless you have diabetes, when you need to see a GP, you need to see a pharmacist. Diabetes puts you at high risk of complications whenever you're dealing with your feet or nails, so you do need medical assistance for that. But otherwise, the pharmacist has most of the range of products that we would have at our fingertips in GP to try and help you sort it out. And the sooner you see the pharmacist, the better, because earlier treatment is easier than if the whole nail is crumbling and discoloured. So there are creams, nail lacquers or paints, tablets, laser and nail removal, and that's what I'm going to talk about today. So the creams and nails and paints that you can buy at your pharmacy, you need to use them religiously, and I can't stress this enough. People do it for a couple of months, maybe less, and give up and say it isn't working. Well, it won't work. You often need it daily or twice a week, depending on the product, and you need to use it for a year, and yet I said a year. So that's a whole year of painting that toenail religiously, daily often, and sometimes filing in between. So filing the nail surface in between is really important because that's what allows the treatment to get down to the fungus and kill it. But there is a new treatment that's been launched within the last year or so called CanesPro, and it's made by the people who bring us out really well-known thrush treatments for women, Canesten. And this is for fungal nail infections, and they are claiming very good success rates. So they are claiming very good success rates cosmetically within about 3 months. And so I think it's really important that you know that there are different products out there. They have different claims, but CanesPro is the one that's claiming to treat things quicker than most others. I can't vouch for it because I haven't had any patients come back, because if it's curing them, obviously they don't come back and show me, but that's what the manufacturer claims. Laser. Now laser is something that I have had patients tell me works really well for them. It heats the nail bed and then it reaches the deep down fungus and kills it, but it doesn't cause any damage to the healthy tissue around the site. So it seems like a perfect solution. It's comfortable, painless, it's fast. You do need 4 treatments over 2 months, and it is not available on the NHS, I'm afraid. So you will have to find a private clinic that offers this, but there are lots out there, and I have seen patients who tell me it works really well for them. So when do you see your GP? Because it seems all we have is creams or laser. As I've said, if you're diabetic, it's crucial that you see a GP. If you're taking over-the-counter treatment and you've used it religiously for a year, or with CanesPro for 3 months, and it hasn't worked, then see your GP. If the fungus looks like it's starting to spread to other nails or to your fingernails, see your GP. And so what else can they do? If all we have are the creams and paints, what can we do? Well, not much is the answer, which is why I normally refer people to a pharmacy. But there is one other additional treatment, which is an oral tablet, an oral antifungal. The one that we usually use is called terbinafine. Now, the thing about terbinafine, and I quite often won't prescribe it, but lots of doctors do use it, so it's a personal choice, is that there are lots of side effects, and I have seen them. So very common side effects are headaches, itching all over the body, loss of taste. Now loss of taste can be temporary while you're taking it or permanent, and I have seen someone with permanent loss of taste, and for me that seems too big a risk to take for a fungal nail infection, which is mainly cosmetic. Diarrhea, very rarely liver failure or a lupus-like illness. So you do need to have your blood tested before you start on terbinafine to check your liver function. And if you stay on terbinafine, you need to have it done every 6 weeks during the time to make sure that your liver is okay. You can't have it if you're pregnant, if you've had liver disease and some other conditions. So it needs a very careful conversation, and you need to weigh up the benefits versus the risk. If it really is just cosmetic and it's not causing you any pain, it just looks bad, do you want to take on board all of those side effects that you might get? But of course, if it's causing you pain and it's proven difficult to handle, then you may feel that that's well worth it. So what can you do to try and prevent fungal nail infections? So don't wear shoes that increase sweating and heat. So synthetic trainers and shoes probably aren't the best idea. You need leather because leather can breathe. Don't share towels with people. Don't wear other people's shoes because you don't know what's in there. Don't share nail clippers or scissors because you could spread fungus that way. And if you have athlete's foot, treat it as soon as possible because, as I said, athlete's foot can lead to fungal nail infections. Keep feet clean and dry all of the time, and you might want to use a bit of talcum powder to just try and help that during the day. Wear clean socks every single day. Wear flip-flops in the showers and around the pool when you go to the gym. It's really important in public areas. And throw old shoes away. Don't be tempted to keep them for a rainy day, and I literally mean that, obviously. If they're old and you're not wearing them, throw them away. So, in summary, fungal nail infections are pesky, but they are mainly cosmetic. It's not really a medical problem unless you have diabetes, and then it is, and then you need to see us. Persevere with over-the-counter remedies. It can take a year, and that's really important. So don't give up, and you'll know if it's working because you'll see new unaffected nail growing up from the base of the nail. And it will probably take a year for a whole toenail to grow. So that's why you need to continue, because otherwise it will spread back into the new nail. Worth thinking about this new product from CanesPro. I can't vouch for it, but it does make some very impressive claims. So essentially, lots of self-help things, and the main message is keep athlete's foot at bay, keep your feet clean, avoid sweaty shoes, avoid old shoes, and avoid places where you might catch things that can turn into a fungal nail infection. So I'm going to put some links in afterwards for you from just some information that you can access about what to do. I will see if I can dig up some information about the CanesPro for you and laser and pop that in afterwards as well. So if you have any questions or any treatments that I haven't covered here, and I'm sure there are some, please let me know in the comments. And as always, if you have topics that you want me to cover for future vlogs, please suggest it in the vlog and I will always do it. So again, thank you for watching as you always do. It's really appreciated and I really appreciate your support. And I hope you bear with me over this shorter vlog period while I just deliver this baby and get things back on an even track. Take care. Bye for now.